Strategy number 13. Prioritize medication questions. Some of the toughest questions on the NCLEX will present for clients with various conditions who all require a scheduled dose of medication, and you must select which patient to see first. For questions requiring you to prioritize medication administration, consider the indication of the drug being given, the condition it treats, as well as the potential risks associated with the late or missed dose. 1. The highest priority should be given to medications that treat or prevent current acute physiological distress. Examples include antibiotics for septic shock, rescue inhalers, osmotic diuretics for high intracranial pressure, antipyretics for high fever, medications ordered Q4 hours because a late dose could affect blood levels and the timing of the next dose, and IV therapy for MPO clients who cannot take medications by mouth and are at high risk for fluid imbalance. 2. Of a lower priority would be medications to treat or prevent reoccurrences or to treat symptoms of chronic disease processes and other stable clients. Examples include an antibiotic for a UTI, a dose of beta blocker, a once-per-shift medication, routine IV therapy, or an IV flush.